This meeting will now come to order. Will the clerk please call the roll?
Mayor Carlett.
Here.
Vice Mayor Edwards.
Here.
Councilmember Finn.
Here.
Councilmember Finsbacher.
Here.
Councilmember Patena.
Here.
Councilmember Hunt.
Here.
And Councilmember Dunn.
Here. Good evening and welcome to the Peoria City Council special meeting of February 2nd, 2021. Last week we laid to rest retired Peoria Fire Captain Dave Ranke. And I would like to pause for a moment and ask you to join me in a moment of silence in his honor. Thank you. I appreciate that. We will now begin our meeting. We have 2 items on our study session agenda this evening, and we are going to begin with Fire Medical Department update. And I will turn it over to our city manager, Jeff Tyne.
Thank you, Mayor and Council. And as part of our preparation for the fiscal year 21-22 budget, we do really a good overview and review of the various major departments here at the city. And included today, of course, we had the good fortune to talk both to our fire medical and our police departments. And first up, we wanted to hear from our fire and medical department on not only a little bit of some of the events, conditions, and trends that they see within their profession, but also some other exciting other opportunities. So with that in mind, we have our fire chief, Bobby Reese, as well as a special guest director that is here as well that Bobby will introduce.
Thank you. Mayor and Council, thank you for having us here this afternoon. It's an honor to be and give you an update of what we've been doing. But let me introduce who I have up here with me. To my far right, I have Christine Nichols, the Director of HR, as you know, and to my immediate right have Deputy Chief Rob Brewster, and to my left I have Jim Bratchard, Deputy Chief of Medical Services. So we're going to give you an update of what we've been doing this last year. Just to give you a refresher on our organization is we're divided up into 4 divisions. First one is operations and training, who is managed by Billy Morris, Deputy Chief. And that's all our fire stations and response to fires and also EMS calls. Next, we have Deputy Chief Rob Brewster, who is our administrative chief that does support services and does the budget and some of the other administrative stuff that we do. And medical services, we got Jim Bratchard here to my left, that is in charge of all the paramedics and paramedic training and EMT training and all of our ambulance operations. And then lastly, we have Gary Bernard that's not here with us today, and he's in charge of our fire prevention and emergency emergency management division. And so that's kind of the overview. Tonight, we're going to cover 5 items. The emergency medical services, what we've been doing this year and what we covered, and then more specifically within that area, COVID-19 and how it has impacted us this year and how we have taken steps to try to prevent it, because it is out there and it's a high exposure to us, and therefore a high risk for us. So what we've done there. And then community paramedicine also falls within the EMS division. And then we'll switch over to Chief Brewster and our Director Nicole to talk about cancer prevention, our cancer prevention initiative. And then lastly, Chief Brewster will talk about the proposal for the fleet management storage building. So with that, I'll turn it over to Chief Bratchard to talk about our EMS division.
Thank you, Chief Reese, and good evening, Mayor and Council. It's a pleasure to talk a little bit about emergency medical services. It's been a challenging year, as it has been for everyone. And I think we've met those challenges and continue to meet those challenges. To give you an overview, we responded to over 20,000 calls for service related to EMS. Of that, we did over 7,000 transports with our ambulance services. We added the 5th ambulance in January, and thanks to your support and guidance for the entire ambulance program. Just an overview, we started off with phase 1 with 2 ambulances stationed at Station 195 up at Pinnacle Peak Safety Facility, and then at 193 just south of Thunderbird on 83rd Avenue. Second phase of that, we added 2 more ambulances, one up by Station 92, approximately 8900 East Union Hills, and then down at Station 91, just across the street here, off Peoria. And then the 5th ambulance came into play in January, and that's at Station 194 over on West Olive. So it's been a dynamic year with implementing that. We managed to get 5 additional paramedics trained this year. They should soon be out of their training and into the workforce here in just a few short months. So, as I mentioned, the pandemic has been caused us to change a lot of what we do or approach it differently. We implemented and trained on all new COVID-19 protocols. The state developed new protocols that involve patient treatment protocols, triage protocols, and decontamination protocols. So we implemented those very quickly at the beginning of the pandemic back in January. We also did extensive training on appropriate PPE use and decontamination, not only for our personnel, but for our equipment and for the safety of the patients that we serve. We secured sufficient PPE, which was a challenge for everybody at the very beginning, and it still remains somewhat of a challenge. Our hats off to Christine Finney and the Materials Management Group, who were fantastic in helping us source the PPE. We both worked diligently and were able to keep up with the increased demand for that and the disinfectant. And we maintained our continuing education and training requirements, which was a challenge with the social distancing. We moved to a virtual format primarily with the teleconferencing options. We managed to keep up to date with all our training through that. And again, kudos to the IT department, which really worked to quickly mobilize and provide those resources for us so we could keep up with the training. And that was quite a challenge at the very beginning because there was a lot coming at us very quickly and we needed to keep up. So, lastly, I'll talk about the community paramedicine program. Again, with your support, which we are very grateful for, and with some of the CARES Act funding, we were able to institute a Peoria-specific full-time community paramedicine program. That funding came up to us in July. By August, we had 27 members trained specifically for community paramedicine, and we were up and running full-time. To date, and it's essentially a little over 5 months of full-time operation with community paramedicine. We've had over 750 patient contacts, over 200 patient home visits, and 86 referrals to outside agencies. So it has presented a challenge. We've done a lot what we would normally do face-to-face in person through the phone, following up on resources, to minimize and protect our patients and our exposures. We've found with the community paramedicine program this year that some of our focus changed, or some of the needs changed in the community, which we were able to adapt to. One of the things that we did not anticipate but came about is we've always tried to involve family where appropriate. Our involvement of family with community paramedicine was more remote. In short, we became the eyes and ears of the family members who could not visit because they were out of town, could not travel, or even if they were local, were not comfortable visiting in person. So we were able to make that connection between the families of quite a few of our patients, and once we get the families involved, we were able to secure resources, and they can continue to secure resources. So we're kind of proud of the way we were able to adapt that program and to fill that niche and that gap. Lastly, we were able to pivot that when the need came up in the community. Maricopa County Department of Public Health instituted a massive flu vaccination campaign. We were able to partner with them, and working with them, Neighborhood Services was Kelly Kincaid and her group, Chris Hallett, were fantastic in putting us in touch with people, providing resources for us, and it truly became a citywide effort that we were able to institute community flu vaccination clinics, some that were on a smaller scale, perhaps at a faith-based organization, all the way up to larger scale with our partnership with the Peoria Unified School District, where we did well over 300 flu vaccinations in several clinics in just a matter of 2 to 3 hours. So that allowed us to kind of take that community paramedicine resource and adapt it to the community, which we were happy and fortunate to be able to do with the resources we had with the full-time program. With that, I believe that's my portion, and I'll turn it back over to Chief Reese.
Chief, before you move on, let me ask if there's any questions. Does anybody have any questions or comments on that portion? Okay, just go ahead then.
Also mentioned that the Fire Medical Department of Peoria operates within a just almost $39 million budget. Next, we're going to go over to cancer prevention and screening, which I'll turn it over to Christine Nichols, our HR director, and to Rob. I will turn it, as I was saying, to Rob Brewster, our deputy chief.
Thank you, Chief. Good afternoon, Mayor and Council. So with our recent loss of retired Captain Dave Ranke due to occupational cancer, this topic really hits home for us. In fact, cancer is the leading cause of line of duty deaths among firefighters. The most recent data pulled from the International Association of Firefighters out in 2019 shows that 75% of the line of duty deaths are cancer caused. So what are we doing here on the home front to fight this? So in 2017, the fire chief handed down a memorandum basically stating that we are going to take aggressive steps in mitigating our risks and reducing our exposures. So we've been ramping this up since then. And in that memorandum, the chief basically said that moving forward, anytime we are on an incident and we're in the mop-up stages of that incident, the overhaul stages, that our members to wear their SCBAs with their mask and breathe in the fresh air, and then also wear rubber gloves underneath their regular gloves, which will help prevent some of the exposure, some of the absorption. In addition to that, we were able to provide a second set of turnouts to our folks, and we'd like to take a moment to thank you again for funding that. That was a very important step in this battle that we are fighting. So now our members have 2 sets of PPE, and so when they go into a hot zone on a working incident, when they come out of that hot zone after their decon, they will bag up their soiled PPE, personal protective equipment, and they will send that down to our resource management, where they will clean the turnouts, inspect them, and do any maintenance or repair that needs to be done before they send them back out. In the meantime, our members put the fresh set on the truck. Through our Health and Wellness Committee, we have a cancer prevention work group that falls under that, and they are dedicated to doing research so we can make informed decisions, educating our members, and putting together training for our members. The most recent training that we did was our decontamination training, and it basically, we started out with an online through our Target Solutions platform. We did the online training on personal decon, how to decon your equipment properly and decon the apparatus properly. And then they followed that up with a hands-on training in person to our members, and each and every one of them went through that. And you can see on the picture there, that's some of the products that we have on each one of our pumpers. We have the bucket there, we have soap, we have the cone to mark it out. So what happens when they come out of the hot zone, they're directed to go over to decon, and it's clearly marked, so they head over there and they perform that. Best practices, again, the decon, that's something we started early on, ahead of some of the other departments. And so that's a best practice doing that. We have our clean cab concept now. So all trucks moving forward, we have one coming in at the end of this month, spec'd out. We've removed the air packs out of the cabs, and we've provided storage space in outside compartments for turnouts. So that way it prevents some of that off-gassing that happens after an incident. You can decon your equipment, but they've shown that there's still some off-gassing that happens. So our goal is to get all that stuff out of the cab to keep our members safe. And then also best practices moving forward, we're looking at with our new station designs, implementing hot, warm, cold zones. So the apparatus bay would be the hot zone where all the diesel exhaust is, and then there'd be a transition zone, which would be the warm zone, where our members can take off their shoes, things like that, leave them there, and then put on clean shoes and then go into the station. So that'll help prevent some of the tracking that stuff in. And then we implemented our clean cab concept SOP, which is in place. Again, that tells members they have to put their stuff on the outside. Oops, sorry, keep their air packs on the outside. And then also we implemented the decontamination standard operating procedure as well. And so through the Health and Wellness Committee, we've been working with HR on the cancer prevention, the cancer screening pilot program. And before I turn it over to Christine to elaborate more on that, we would like to take a moment just to thank you again for funding that. It's another huge step in this battle and to keep our members safe. And so we really appreciate that. So with that, I'll go ahead and turn it over to Christine.
Thank you. Are there any questions or comments in that regard? Okay, moving on.
Okay, well, good evening. It's a pleasure to be before you and also to be partnering with the Fire Medical Department on this important initiative. In addition to the steps that Rob just mentioned, and with the support of the Mayor and City Council, Peoria is implementing a pilot cancer screening program for firefighters. A bit of a mouthful, but I'm going to get it out. The city first began exploring this program in 2019 in response really to the nationwide issue and to supplement what fire is already working on. The city of Peoria will be one of the first cities in the valley to implement this type of program, but fire departments nationwide are looking into similar initiatives. We're currently in the process of finalizing details with the Fire Medical Department and the city's health insurance broker to kind of iron out all the details with the providers. And then we will be ready to start the next steps. Goals of the pilot program, really while fire has been focusing on mitigating the risk, the goals of the cancer screening program are early detection and treatment. This is a multifaceted approach that's designed to get the best results. Through the program, firefighters will be screened, and they will be eligible to receive screenings that may not be ordered by a doctor or may not be ordered until a later time in life. For example, a routine colonoscopy is typically covered around the age of 50, and usually a doctor won't order that test unless there's something going on or the patient has reached that age. Under this program and after the risk assessment, we will know if the firefighters need that type of screening, and if they do, it will be approved regardless of the age. So the screenings will be individually based on the risk factors, and we're hoping that they will lead to detection of cancer in earlier and more treatable stages so that there's not as many complications, and hopefully we can avoid any serious issues. We do anticipate benefit for the firefighters that you know, the possibility and potential for longer and healthier lives, which is the ultimate goal, obviously. And there may be added benefit to some fiscal savings with the self-funded workers' comp or employee benefits trust. But the main goal is to make sure that we're taking care of the employees. As far as next steps go, the firefighters will all receive an annual screening to determine their risk level. Once we know the risk level, then those with the highest risk will be included into the pilot program as a participant, and the screenings will begin. Employees will receive the screenings, as I mentioned, at no cost. And the next steps with each employee will really depend on what the results are. They may be referred for more screenings or treatment, or they may get cleared until the next time for their follow-up screening. We will monitor the program and report back to you with aggregate outcomes and successes of the program, because I know there will be some great ones. And again, thank you for the funding for this program. I'm really excited to be able to work on it and hopefully make a big difference. Thank you.
Let me just add that, we thank Mayor, Council, and City Management for a lot of the support on the cancer prevention. And when you put all that together with the second set of turnouts that you folks supported and funded, and all the approaches that we've taken, and Dave Ranke, Captain Dave Ranke, went on the road nationwide and preached this prevention, is our world changed that day. And we thank you for that. We sincerely thank you, because it is a big difference for us. Next, we
Chief,
have.
Before you move on, I just have to address that. I mean, I think the cancer screening and all of the prevention that have been put in place, I hope that lives are going to be changed, lives are going to be saved. People are going to be healthier in our fire department. I know for a long, long time, firefighters have always known that they are going to have a shorter lifespan than other professions. And if it doesn't have to be that way, we certainly want to do everything that we can so that it isn't that way. So I really thank you for all of your efforts moving forward, and I would love to have updates and find out if we've been able to make a difference.
Thank you, Mayor. Next, we have a proposal of a fire fleet storage building, and it's on the consent agenda, and we want to give you all the particulars about it right now. But in the CIP budget, we had nearly $2 million for steel canopies to protect our fire trucks and our equipment. And for nearly the same dollar amount, a little bit more, we can have a storage building. A big difference is that with the steel structures, it adds little value to the facility that we put it at, where the storage building would start to appreciate right away and would not lose value, it would appreciate in value. So with that, I'll turn it over to Deputy Chief Rob Brewster.
Thank you, Chief. Okay, so this is a picture of our reserve fleet, which is currently stored over at our Support Services yard on 78th Avenue. So as you can see here, our fleet is out, exposed to the elements. With the growth of the fire department and expansion of services, our apparatus base space is limited to frontline equipment. So it's forced us to store our reserve equipment out here at our Support Services yard, and also under some high bay parking that we have up at 195. And so as you can see here, this is the reserve LT ladder tender unit that we have. It just went into reserve status about 1.5 years ago. And as you can see, we pulled the decals off of there recently, and you can see the oxidation that's occurred on the paint. In addition to destroying the paint, it's wreaking havoc on our hose, the hydraulic lines, the tires, all the lights, the lenses, everything. So it's really created a problem. So as the chief mentioned, our solution was to let's enter in the CIP some high bay parking so we can start to protect our equipment. And as you can see here in this next slide, this is an example of that, which is up at Station 195. And here's some of our trailers. And if you look closely, you can see the oxidation on the trailers. And you can see that with the high bay parking, we're still pretty limited on our coverage there. There's some holes in that. So it's it's not ideal for storing that stuff out of the elements. And so we came across this building here, which is on Selden, directly across from our support services building. This building's a little over 26,000 square feet. And, you know, we came across this building and we thought, you know, this right off the bat would be a better capital investment, but also this will meet all of our apparatus storage needs. Not only will it keep it out of the elements in a climate-controlled building, but also it will add a level of security to it as well. It's not out in the open. So that's, let's see, and here's a picture. Oh, and I'm sorry, go back here. Oops, sorry, I clicked the wrong button. Okay, so in addition to storing our apparatus, we have a need to store our EMS supplies. And so this will solve that problem as well. Currently we're running over 20,000 EMS calls a year, and so our burn rate on EMS PPE and supplies is pretty high, so that requires us to keep a large stockpile of inventory. And then with the recent pandemic, that ramped up even more, and we found that we didn't run out of supplies, but we got to critically low levels. It required our folks to put in overtime to try to, and working with materials management, as Jim mentioned, to try to find other vendors to supply us. And so some lessons learned there is that we need to, you know, make sure that we stockpile adequate supplies in the event something like that happens again. And currently we have all of our stations, we have the closets in our stations full EMS supplies. We've had to rent a few outside storage units to store supplies. And then over at the materials management warehouse, we have several pallets of stuff. So our thought is, you know, if we can get our apparatus in here, get all of our EMS supplies, all of our PPE under one roof that's close to our support services building, our folks can go across the street, we can receive the shipments as they come in, we can send it out, and we can keep everything kind of central and keep a close watch on it and keep close inventory on it. This next picture is a view of the outside from the rear there. You can see we have plenty of room to get around the outside. We have plenty of bay doors there to get our equipment in and out. And then you see an interior shot there. We have the apparatus storage space here has swamp coolers, and then we have about 10% of that building is AC controlled, where we would store like our critical EMS supplies and things like that. So the benefits, again, just to touch on those, long-term capital investment that'll take us well into the future with our storage needs at all levels. Keeps our equipment out of the elements and secure. And with that, take any questions.
Thank you. I think it's really important that we keep those trucks red,
Yes.
not faded. Council, any questions or comments? Councilmember Hunt?
Just quickly, who found this amazing building?
Actually, my support services supervisor, Rob Worms, he called me one morning and says, hey, I just found this building that came up, and it would probably be a better option than the high bay parking. So we went over, we looked at it, and yes, that will definitely, it was a good find.
So
Again,
we are
good price, too.
purchasing this building, is that correct?
It is on the consent agenda for your
To
approval to
purchase.
purchase, and
Okay.
yes, we would appreciate your
Well, it's an amazing
consideration
building.
in that matter.
It's amazing looking, and really, I can't imagine us designing anything any better that would meet your exact specific purpose, so it's great.
Okay, thank you. Anyone else? No? Thank you. Chief, did you have some more? Is that it? Okay, we appreciate your presentation, appreciate knowing what you're doing and how you're moving forward and getting better all the time. Thanks for all your efforts, especially during COVID.
Thank you.
Stay safe out there. Mr. Tyne?
Great, thank you. And as we transition, we'll now be able to talk to another group of first responders, of course, Peoria's Police Department. And I think to your point, Mayor, what a unique time for our first responders, both our fire, medical, as well as our police, is not only are they dealing with the increased calls that result from COVID and the unique calls that require a different perspective and a pivot, as Chief Reese had mentioned, but this is also at a time that we're seeing within Peoria that there is continued residential development, that we're kind of ground zero for development at this point in time. So with all of those increased pressures, they've worked within the resources they have and provided services that have really matched what is important for the time here in this COVID era. So, and you'll see very similar story here with our police department, who have a number of different items that they wanted to speak to, including something that was referred to in our last study session with our Neighborhood and Human Services Department, which is our misdemeanor repeat offender program. So with that, I'd like to introduce Chief Miller, who will also introduce his amazing staff.
Good afternoon, Mayor and Council. Thank you very much for having us here today. I'd like to introduce Deputy Chief Benny Pena to my left, and a little over further to the left is Commander Doug Steele, who both will be presenting on the MRO program that was previously discussed. So I'd just like to give you an overview of 3 areas that in our police department, one of which is the budget, our MRO program, and then a new program that was instituted actually yesterday, and it was through funding approved by the council that we were able to do this. So just a general overview of our department, where we are right now, is Deputy Chief Pena. He's in charge of investigations, criminal analytics, our crime lab, and all the specialty things that happen after a patrol officer handles a call for service or is involved in a critical incident requiring specialized units such as SWAT or traffic to go out and investigate. Deputy Chief Marcel Spaulding, he is in charge of our patrol, our operations, so all the calls for services that the community might call for, he's responsible for ensuring that our commanders, lieutenants, and sergeants are serving our public well and providing the public safety that they need. And then Deputy Director Rob McDaniel, he's in charge of our comms, our communications division, anything having to do with specialized civilian staffing and things like that. He's the one that oversees all those programs, including our community relations department. Oh, let me back up. And just a real quick overview of our position as far as how many officers we have, how much staff we have. We have a total of 305 employees, of which 203 are sworn employees, and then the rest are support staff and professional staff. And just a real quick overview of our budget, what we've been able to do. We've been very compliant with the request from our city manager and deputy city managers to really buckle down on our budget to make sure, number one, that the public receives the services that they require and demand, and at the same time be fiscally responsible, understanding that we are one of many teams in our department, in our city, that have to come together to reduce our budgets. So in doing so, we reallocated $250,000 from our budget to ensure that our vehicles are up to speed, that they are properly equipped, and that our officers have all the retrofitted equipment that is required for a black and white police car. Another thing that I have in my budget that's going to hopefully help in terms of getting our message out through social media and through our public information office is to civilianize one position that was formerly a police officer position, and now we want to make it a civilian information specialist that'll help bring in a different perspective to how to get word out via social media, and then also at the same time be able to be a spokesperson for our department and our city in the event that is ever needed. And we work hand in hand with our communications department in the city, and they are very supportive of this idea because, as you know, as every month and week goes by, every week and month goes by, social media becomes such a huge responsibility for any organization to properly get information out. So that's something that that I'm looking forward to having. Another thing is our canine support. We had to retrofit a new police car to make sure that the police car that we had for the canine, for the dog actually, was compliant with state laws and regulations for the safety of the dog and the safety of the canine handler. This is something that the next item on here is the animal control trap and neuter spay, and what we're doing with that is we've budgeted from last year some money set aside to trap feral cats, trap them, send them out to get spayed or neutered, then put them back into where we found them. It sounds a little bit counterintuitive, but the animal people that know what they're talking about, they found this is the best way to go about doing that. Again, that ends up helping reduce some health issues that might come up from feral cats, along with keeping the population of feral cats down. One other thing that we did was our software support and expansion. As just one example of some of the things that we did there is, first of all of our police cars now are equipped with the latest equipment. Latest as of today, but who knows what happens in the next few days or the months that come. But it has the latest equipment right now in terms of how we are able to use our in-vehicle computer system, and it's all tied in with our communications department, along with all of our state and federal databases. So that was a huge expense, but one that was very important. Another thing that we did that we are considering doing is creating reorganizing our department and making a peer counselor, making a position for a peer counselor rather than have it ad hoc. Currently, we have a situation where our officers, when they seek peer support, they go to the people that they know are the people that are trained in that area, and there are other officers and staff members. But what we found is there is such a need for it, the peer counseling, that it overwhelmed the current structure that we have. So I wanted to create a position that is a peer counselor, a coordinator that's going to coordinate all those efforts, but at the same time be able to provide other police services. It will be a full-time police officer that's going to be the peer counselor coordinator, but will be able to give service to our department members as far as any kind of counseling they may need. I just want to really re-emphasize that as much as we cut to the bone everything that we could, public safety is obviously foremost in all of our minds. I feel very comfortable in the fact that we're able to make these adjustments without any detrimental effect to the public safety. So as far as the staffing update goes, I want to say that we have really streamlined our recruiting and hiring process. I've been saying that for a couple of years now. It just keeps getting better and better and better every month that we do this. We have a staff now that is has received additional training on how to, number one, recruit qualified candidates, how to have them go through the background process, and then also how to train them once they are hired. This is one thing that law enforcement agencies throughout the country are dealing with recruiting issues. I have been in other departments. I've worked for other departments, and I can tell you that I do have some experience in the background of recruiting and whatnot as far as hiring someone. And I can say that in Peoria, we have one of our greatest tools is the support that we have from our community, our council, mayor, our city manager, and deputy city managers. And then more importantly, we support each other once we're hired on the police department. We, by and large, love coming to work. We like serving the public that are here in Peoria. And that is the greatest recruiting tool that I think anyone could have. About 2.5 years ago, we were about 15 officers down. Now, because of some adjustments that the city manager has allowed us to make, we are fully staffed in terms of being fully staffed with 203 officers. And again, we always, that kind of fluctuates throughout the months because of someone separating for the department for whatever reason. But generally speaking, we are fully staffed as far as our officers go. Having said that, we are doing some some testing on February 27th for entry-level officers to fill some potential vacancies we're going to be having. We also hire laterals from throughout the country that come to us because they go on our webpage, they like what they see. And then after a certain point, I will talk to them and kind of not necessarily sell what Peoria is about, but just kind of give them a perspective that I think is important for them to hear, that all the things that I mentioned earlier about the support that we have in our community. That's something that when I hear from the laterals that they're not getting from where their departments are. And again, we try to keep things professional. We try to keep things simple. And the reality of it is, if you're in law enforcement, our purpose in total is to serve. And if they come in with that mindset, they're more successful in being an officer or a civilian employee for us. So right now we have 4 recruits in the Maricopa County Sheriff's Office Academy. That's one of the agencies that we use. We also use the Phoenix PD Regional Academy, which we just had a recruit graduate from there last week. We are accepting applications right now for a forensic services technician. That's someone that, like a crime scene investigator, that goes out and takes prints, photographs, and collects evidence. And then, as I mentioned earlier, the public information specialist that I'm hoping to advertise for and hire. Our community relations unit is fully staffed, and they have been under this era of COVID. They've been very instrumental in getting our word out, our message out to the public via I can't think of the word right now. Help me out here.
Social?
So via social media, thank you. That just slipped my mind. Social media, and then also doing everything they can, either through social media or making contacts and delivering items to the public. Our recruitment staff, we just realigned it. We have a new lieutenant in there, a lieutenant that was there has transferred to another section in our department. We have a background investigator and then a supervisor, along with 2 full-time in-service officers that do training for our personnel. Our crime analysts, which is when you or your constituents want crime stats, we have 2 analysts that are there, and it's fully staffed. We also, instead of having one full-time officer, we have a full-time officer and a civilian firearms instructor that does all of our mandatory training that's required by not only our department, by our SOPs, but also by post. And then recently, we hired a business systems analyst that keeps all of our computers up and running and all of our systems up and running. And one of the other things I'd like to talk about is our crime stats. We have the mid-shift patrol squad that we implemented about a year ago. This is something that, again, going back to the Matrix report that was issued a little over, well, almost 3 years ago now. Some of the suggestions were a modification of start times for officers. We've implemented that, and that has been really received very well by the shifts that mid-shift covers. It kind of goes over, it blends between 2 shifts, and it takes on work that an off-going shift normally would have had to handle. And again, this is a work in progress. I would like to see it staffed a little bit more to make it more effective, but right now it's working, and I'm pleased with the way that it's working out. The other thing too is it does reduce our overtime to some degree, and again, we are in a situation in our business that we never know what we're going to encounter. A simple call can turn into a tactical situation where you end up having to call a bunch of people in. But that mid-shift has really helped out, and I'm waiting to see how that affects our overtime and our response time, as well as last year we realigned particularly our northern part of the city with dividing one area that was one area, we divided it into 3. We've added a couple officers up there to help mitigate some of the calls for service as far as response times. So last year, we handled almost 7,000 calls a month, which was 83,000 calls that our communications department was receiving. And then, I'm sorry, that was in 2019, 83,000 calls for service for the year. And then last year, we had 71,000, so it was a reduction of calls for service. And that has a little bit to do, we believe, with people staying home. On the one hand, it could create different kinds of calls, or an increase in, let's say, family type calls versus crime calls. So we are very busy, and we're handling all the calls that we can to the highest degree possible, with our response times being below the national average. They continue to be, they're hovering right around the national average. So I'm very comfortable with the amount of calls that we're receiving, and then the quickness in which we're answering those calls. At this time, I'd like to transition over to Chief Pena, and he can introduce the next portion of the program. But before I go there, are there any questions with what I've already discussed?
Councilmember Patena?
Thank you, Mayor. Chief, what exactly is the role of a peer counselor, and how are they selected?
So a peer counselor, as you can imagine, officers in particular, and I think maybe even a little bit in the fire service, kind of like to keep to themselves. They don't really want to share their internal turmoil that they may be going through. So they will seek out a peer member, in other words, another officer or another civilian employee that works with the police department. Those peer members go through a training to kind of help them work with people that may have an issue. And it's usually something as simple as just talking about whatever the issue is. It could be finances, marital problems, it could be problems they're having at work. And it's strictly done in a confidential manner. So I get the number of peer counselings that we've done, but I don't get the actual, and I get the general idea of what they're talking about, but nothing specific about an individual officer or personnel. So it's something that's very, very important. Thank you.
Councilmember Hunt?
Thank you, Chief. What a good report.
Thank you.
I want to piggyback on Bill's question regarding peer counseling. We know the stress and we know the things that police officers and firefighters see that cannot be unseen. And we know the extreme stress that this places on them in their personal lives and their professional lives. I was not aware of the peer counseling. I was interested in what the department suggests or requires as far as professional counseling. Since I know about the peer counseling now, let's say that someone seeks the peer counseling and the peer counselor just says, you know what, I'm not going anywhere, this person's really in bad shape. Where does that go? How do you I don't want to use the word force, how do you encourage them to go a step further and to get some real help with a really serious problem?
So, Councilmember Hunt, that was going to be a portion of the third part of it. I can go out of order and
Sorry
discuss
about
that.
that.
No, it's okay. I certainly can go to that now if you'd like.
Well, if it's going to be covered, if it doesn't cover, I'll ask the question again.
Okay. No, I certainly would like you to be knowledgeable about that, because it's a program actually that you help support and kind of push us towards it. So I do want to tell you a little bit about
Okay.
that, if you don't mind.
Either now or when the time is appropriate.
Let's go in order then. Okay, is there anything else?
Nope, I think
Okay.
that's it.
Commander Pena? Or Chief Pena?
Thank you, Chief Miller. Thank you, Mayor and Council, for having us today. I'll be introducing Commander Steele, who'll go over the specifics of our MRO program, but I know that last week you got the briefing from Neighborhood and Human Services, but we need to reiterate how thankful we are for that partnership and development of that department. For many, many times for the last couple of years, as we developed our CIT program and our MRO program, we were also taking some of the roles of some of those service providers and coordinating that, and under Director Hallett's leadership, they've taken on that responsibility and support us. So we diffuse the situations. We make oftentimes the first contact with many of the folks in crisis, but without that follow-up and allowing us to focus on actually what we're very good at is that first initial contact, diffusion, de-escalation, because you've seen a lot of the remnants of police departments that are not prepared to go into a crisis situation and handle it with a higher degree of training and a higher degree of professionalism and preparation for that crisis. And that's where you see so many of these controversial contacts go awry. Excuse me, we're very focused on teaching our officers exactly what they're going to face, so it's not a shock when somebody comes at them in an aggressive manner or is using language aggressively or displaying signs and symptoms of autism, which can be misunderstood as someone they are in crisis, but they're not being violent. They're just misunderstood. Or somebody in a mental health crisis, drug addiction, all of those things. That's what we're developed a very, very thorough and robust program. So I'll let Commander.
Mayor and Council, thank you so much for allowing me the opportunity to talk about CIT MROPE, a program that I'm very, very proud of to be part of at the Peoria Police Department. What is CIT or MROPE? You'll hear those acronyms thrown around, but to give you kind of the definition of what those things are, CIT is a crisis intervention team. This is a program that actually trains officers to identify those individuals that are patients, not suspects. Identifying that the individual's in crisis, and it could be from mental health, it could be from drug abuse, alcohol abuse. It doesn't necessarily have to fit in one particular area, but it allows our officers particular training to identify those individuals that are in crisis, and then how do we go about getting them help that they need. The good thing about the CIT program, and it actually kind of carries over even to our peer support program. The benefit of our officers obtaining this training gives them a way to identify individuals in crisis, which sometimes is our own. So this program has been beneficial, and actually we've seen a large increase in our officers asking for help, which is awesome. Realizing that, hey, wait a minute, I'm okay, but I need someone to support. And that's through peer support, and I think you're going to get into more detail later about some of reaching out to programs, through programs that already exist with the city, and then other things that we're putting in place to help officers deal with this. CIT, even though CIT MROPE is a particular unit that involved 1 sergeant and 2 detectives, CIT training actually is about 50% of our department that has now received CIT training. Peoria, we have the benefit of having some really, really strong CIT advocates, and that program has grown, and we're actually one of the catalysts that get West Valley agencies to get their officers also involved. We've hosted training, been part of the training process. Our detectives, Detective Scott, and, well, Vice Mayor, there you are, that you spend time with those detectives that give them some of that training. So it's a really, really great program on mental health and identifying crisis. The MROPE program, which I think Director Hallett talked about a little bit in our partnership with Health and Human Services, is the misdemeanor repeat offender program. Really, what those 2 programs are is identifying community members that have mental health, substance abuse, homelessness, and how can the Peoria Police Department respond to them in a way that's not getting them involved in the criminal justice system? That doesn't do anything for them. It doesn't help them. That's not necessarily the appropriate place to identify and maybe perhaps correct a problem. With the help of Human Services, Health and Human Services, their partnerships with Phoenix Rescue Mission and other things, we basically try to come at a service-first approach. And if you would look at, and I can go back real quickly, if you look at, or if you see Detective Scott and Detective Scheidemann around, they're not dressed in a standard blue uniform. They look a little bit different. That's just to get to people to relax. Now, they still look like police officers, and they are still carrying the equipment that they are police officers, but their intent is, I'm here to help you and support you, rather than, hey, I need to go ahead and make a physical arrest. And really, we're looking at trying to create a better quality of life. That is how the HOPE process started, which most of you have attended, one of our HOPE, where we're homeless outreach, really providing those services, bringing them together and trying to find a way to solve a homelessness issue or a mental health and or abuse, a substance abuse problem. Really, the goal is to change behavior. If I can not have to physically arrest you, get into the system, tie up court time, time up prosecutors, and get you in services and actually get what you need, Ultimately, we think this has a better community impact, and ultimately reduces calls for service, ultimately gets those individuals the help they need. And really, MROPE, when we talk about an MROPE or misdemeanor, these are generally lower level livability type crimes. You see the trespassing, littering, minor criminal damage type events. We're not talking about major violent felonies. That's treated in a completely different way. This is those individuals that are just trying to survive on the streets or trying to survive with their issue, and we're addressing that. We will lead with services and education. Most of our contacts at this point are actually consensual contacts. We don't necessarily have a criminal nexus always, and it's just us reaching out and making contact with those individuals. We have a fantastic partnership with Health and Human Services here at the City of Peoria. Director Howlett's group is invaluable. Also the funding and support of Mayor and Council in reference to funding to work with CAS, getting us beds available, getting an actual facility that works with these cases. Our partnerships with Phoenix Rescue Mission have had a profound impact on our community. And unfortunately, something that we're going to be continuing to deal with, I think, for, honestly, probably forever. And these type of outreach programs, like I said, have been invaluable on the impact that we can have rather than us just actually making a physical arrest. We're really making a difference, and that's really why we put the badge on to begin with. So CAS, Phoenix Rescue Mission, the City Prosecutor's Office and our City Court have been very, very good at working with us. So we actually, it's really a holistic approach to trying to solve these problems. And that's really been very, very effective. And with that, any questions that you might have on our CIT? That's a really 35,000-foot level overview of that program.
Councilmember Hunt, did you have anything you wanted to follow up?
Doug, I guess I didn't really hear what I expected.
It's still coming. There's more coming, I
okay.
believe.
Sorry.
No, you're good.
All right, waiting.
Okay. And now, Councilmember Hunt, what you've been waiting for all evening. We found that officers that are involved in critical incidents over and over and over again, eventually it'll start to weigh on them. And we have resources within the city, with our HR department, as well as some private organizations that offer counseling. The issue is, how do we get the officer to go to the counseling? So Deputy Chief Marcel Spaulding took this on and did some research on this, and he is the author of the work that was done to create this Traumatic Event Exposure Program, or TEE. And so what happens is our officers, the actual program is a critical incident program is developed to assist all emergency personnel in dealing with acute, accumulative traumatic incidents that could result in PTSD, psychological issues, and suicides. The number of police departments nationwide have great programs designed to assist with counseling. However, they are all voluntary and only address sworn personnel. The Peoria Police Department's program has a mandatory participation programs for all employees, sworn and non-sworn, who deal with traumatic incidents. So just to give you an overview nationwide, we had the number of line of duty deaths in 2020. And this includes the disease-related count, including COVID. There were 210 officers that died in 2020 through either, mainly through some kind of traumatic event, either a traffic accident or a shooting of some kind, where their life was taken from them. The total number of duty-related deaths on assaults, car crashes, heart attacks, and this is according to another source, there were 113. And then the number of suicide deaths is 173. So you can see that suicide can be prevented, and it's through counseling and through early intervention that can be prevented. So with that said, our program, and it kind of touches a little bit on what you were talking about, Councilmember Hunt, as far as how do we get them to go? Can we make them go? In this program, we certainly can. So the first step is voluntary. They seek the counseling themselves, either through peer counseling, through EAPs, through HR, and through a couple of other programs that are outside the city, which is Blue Pause, and then Bulletproof, which are all counseling type programs. The other thing is any observations that are seen by either partners or supervisors where they see an officer acting out in ways that are just a little bit odd, they can bring that to the attention of a supervisor or manager, and then we have the ability to make them go seek counseling. The other part is that let's just say everyone handles calls throughout the year and they seem to be okay, but we're not sure. We're doing it incident-based. So with their direct exposure to a critical incident, and it could be just about anything, a horrible crime scene, a traffic accident, it could be a shooting or anything like that. 6 within 6 months, or 10 within 12 months, then that'll be mandatory for us to send them on their way to see a psychologist. And then the fourth portion of it is position-based, and what we decided there is the 1 year pool includes our detectives, our crime scene technicians, our communications, our dispatchers, our victim units, the people that investigate child crimes, our canines, our victim assistance folks, or our records clerks who actually see a lot of the information that come in. So that's every year we can send them to go see counseling, Then the third one is a 3-year pool, which includes our patrol, animal control, our police service officers, our detectives, our traffic officers, and our communications managers. So there certainly are ways to have them go voluntarily, but if we see something, it could be a one incident, and if we see something that's out of the ordinary, then we'll direct them there. And then the good part for the person that we send is all we want to know from the psychologist, are they okay to come back? We don't need to know the details of what's disclosed in that meeting, so it's strictly confidential. And so everyone participates in the program, they benefit, and this program minimizes the idea of having to go see a psychologist or a shrink, so to speak. And the program includes sworn and civilian, and again, most of the program, the way we send them to is voluntary. The program promotes seeking psychological assistance for clarity and coping skills, and will ultimately become the normal behavior for employees to help themselves in the future. So we are creating the groundwork for the future of our department, where officers are going to feel comfortable seeking help on their own. So that was a general overview of some of the highlights of our department. There are many, many more things to talk about, but I thought you would be interested in those 3 aspects of it. Are there any questions?
Councilmember Hunt.
Could you go back 2 slides from the end here? Okay. There are a lot of acronyms down here at the bottom, and I don't need to probably know what they all are, but what about your detectives that major in sex crimes? Would
Right.
they be would that be a really high stress level when I know some of the operations they've run have been the operations that deal with underage sex trafficking and so on. Which of these are they, 1-year pool or 3-year pool?
So Doug, if you don't mind.
They're in the 1 year pool.
Don't you think they should see somebody more often?
And honestly, the benefit is that a lot of them do already.
Okay.
Have that. But not only are they in the 1 year pool, there are incident direct exposure thresholds that can be met. So if they are to have a large caseload, a very high level type of high stress, or what we consider critical incident, the supervisors could refer them more than the 1 year. But I will tell you, I mean, I'm not disclosing anything, most of them already are seeing somebody between peer support and or seeking some type of outside counseling. Kind of like I said, it's not quite the stigma that it used to be. So the benefit is our officers are getting help and asking for help.
I would think the more officers or detectives or whoever they are who ask, the less stigmatized it would be.
Agreed.
Because they would understand that they're getting help. Okay, I have another question. I wrote down here that if they don't offer to go, you make them go. How do you do that? Do you just give them the days off and say, you're not coming back until you report, bring us a
In
note
this
from
case,
your
keep in mind, this
counselor?
program just began yesterday.
Oh,
And
okay, not a lot of history there.
not a lot of history, but I can tell you what the plan would be. If
Okay.
we saw some behavior that was was concerning to us, we would direct them to go see a psychologist. We'd have them do it on duty. We would get the feedback from the psychologist as to whether or not they are suitable to remain on duty or to be off. And in that case, we could talk about either using sick time or some kind of compensatory time.
And what if they just don't want to go? They're like, no, chief, no, I'm okay, I'm okay.
They have
I'm
to
not."
go.
And what happens if they just don't?
They have to go. If I tell them to go,
Okay,
they have to go.
if they like their job, they have to go.
Yeah, yeah.
Okay, the counselor, do you have a list that they can choose from, or is there one person, or?
To begin with, we have one counselor who we've been working with, and.
That's a private person
it's a-
outside of,
It's a private person outside the department, and then we'll reach out to see if there's any other counselors that are interested in being part of the program.
okay, I probably still have other questions, but I'll ask Andy. If I do, I'll shoot it right there
Okay,
to the top.
Sounds good.
Okay, thank you, guys. It really, really good. And Benny, I love your program. I'm really proud of that program. So, and proud of all of you and what you do.
Thank you. Thank you.
Anyone else? No? Okay, thank you very much for your presentation and for visiting us tonight and for all that you do every single day. You've got a tough job, and we appreciate it so much. Mr. Tyne?
Great, that is all we have for our study session. Thank you for the time on this, and look forward to our next study sessions on departments as we lead into the fiscal year 22 budget. Thank you.
Right, then we are adjourned until our 6 p.m. meeting.
As a courtesy to others, please silence all phones. If you would like to address an issue that is on the agenda, or if you would like to speak to the council regarding a non-agenda item, please complete a speaker request form, which can be found in the front lobby of the Peoria City Council chambers or in the tray to the left of the speaker's podium. Please place the completed speaker request form in the second tray to the left of the speaker's podium labeled Request to Speak. All speakers will have 3 minutes to complete their comments. A countdown clock is easily visible on the left side of the wall behind the City Council dais. Only items listed on the agenda may be addressed by the council. Since items presented as part of a speaker's request have not been listed on the agenda, and due to the requirements of open meeting laws, the council will be unable to respond to items presented as part of the speaker's request. However, please be aware that your comments will be noted. The speaker's name will be called to speak at the appropriate time, in the order that the forms were received. Thank you for your interest and participation in the Peoria City Council meeting.
Peoria City Council meeting will now come to order. Please rise for a moment of quiet reflection and the Pledge of Allegiance led by Vice Mayor Edwards.
I pledge allegiance
To the flag
Of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. The clerk will please call the roll.
Mayor Carlick.
Here.
Vice Mayor Edwards.
Here.
Councilmember Finn.
Here.
Councilmember Binsbacher.
Here.
Councilmember Patena.
Here.
Councilmember Hunt.
Here.
Councilmember Dunn.
Here.
Youth Liaison Tawari. Youth Liaison Van Winkle.
Here.
Welcome to the Peoria City Council meeting of February 2nd, 2021. Health and safety of our residents while assuring that the actions of your city council remain transparent. This plexiglass is one of the many changes that have been put in place amid the COVID-19 pandemic. Within the council chambers, masks are required and capacity is limited. The barriers you see between us allows us to conduct council business without a mask while controlling the possibility of transmission. For additional in-person and remote viewing and speaking measures, please consult the City of Peoria website. The first item on our agenda is a presentation, and for this I will turn it over to Councilmember Finn, the chair of the Council Subcommittee for Boards and Commissions.
Thank you, Mayor. If you would all please turn your attention to the screen for a short video.
Ranging from arts and culture to economic development to planning and zoning. They're made up of residents and business leaders who bring a wealth of personal and professional experience and who generously volunteer their time, energy, and wisdom to our community. These members meet on a regular basis, deliberating and collaborating on various projects and issues of importance for the benefit of all Peoria residents. In the past few years, they have had a direct role in influencing meaningful projects like the Veterans Memorial expansion, multiple public art installations, accessible park amenities, and our Youth Advisory Board even collaborated with the State Attorney General's office to team up in the fight against tobacco sales to minors. As we welcome new volunteers into this exceptional group of people, I want you to know how much we appreciate your willingness to share your time and expertise with our city. On behalf of the City of Peoria and the Peoria City Council, I want to express our gratitude and appreciation. Your service makes a difference. It's an honor to have you working alongside us as we shape our finest future.
As the mayor mentioned earlier, due to necessary changes put in place to enable social distancing, we have modified our tradition of personally recognizing new board and commission members at a council meeting. Instead, new members are invited to send a picture of themselves holding their certificate so we can recognize them and celebrate their service to the city. The following newly appointed board and commission members have accepted their certificate of appointment and have sent a photo. Their photo will appear on the screen. So first up, we have Stephen Hayes, Citizen Commission on Salaries for Elected Officials. Round of applause for Stephen. Next, we have Tubashuku Okeke. I hope I did that correctly. If not, I apologize. On the Historic Preservation Commission. Round of applause. And then finally, we have Michael Mitchum for the Industrial Development Authority. Another round of applause for him. Congratulations and welcome to our new board and commission members. Thank you.
Thank you, Councilmember Finn. And the next item on the agenda is a proclamation recognizing February as Teen Dating Violence Awareness and Prevention Month. And I will be reading a proclamation starting with, whereas 1 in 3 adolescents in the United States is a victim of physical, emotional, and verbal abuse from a dating partner, a figure that far exceeds other types of violence affecting youth. And whereas high school students who witness, experience, or perpetrate physical violence in a dating relationship are more likely to use drugs and alcohol, are at greater risk of suicide, and are much more likely to carry patterns of abuse into future relationships. And whereas nearly half of teens who experience dating violence report that incidents of abuse took place in a school building or on school grounds. And whereas only 33% of teens who are in an abusive relationship ever tell anyone about the abuse, and 81% of parents surveyed either believe teen dating violence is not an issue or admit they do not know if it is one. And whereas, by providing young people with education about red flags and root causes of violence and building skills for healthy relationships, and by changing attitudes that support violence, we recognize that teen dating violence can be prevented. And whereas it is essential to raise community awareness and to provide training for teachers, parents, caregivers, youth service providers, and trusted adults so that they may recognize when youth are exhibiting signs of dating violence and serve as allies for prevention. And whereas the establishment of Teen Dating Violence Awareness Month will benefit young people, their families, schools, and communities by spreading awareness that everyone has the right to a safe and healthy relationship and to be free from abuse. Now, therefore, I, Kathy Carlett, Mayor of the City of Peoria, Arizona, do hereby proclaim February 2021 as Teen Dating Violence Awareness and Prevention Month. In support of this month, I am wearing orange, and many of our council members are also wearing orange, and we will be lighting City Hall in orange lights from now through, at least through the end of this week. So I hope you'll take a look at that, and I hope that you will be supportive of this very, very important program and learn about as much as you can about it. Thank you. We will now move on to the consent agenda. All items listed on the consent agenda are considered to be routine or have been previously reviewed by the City Council and will be enacted by one motion unless a council member requests an item to be removed and considered in the normal sequence on the agenda. Members of the public have been given the opportunity to submit comments and questions through a variety of electronic methods. And I have received no speaker request forms. Council, are there any items to be removed from consent? Seeing none, do I have a motion?
So moved.
I move to accept the consent agenda.
So we have a motion and a second. Council, please vote. And the consent agenda passes unanimously. We will now move on to the regular agenda and new business. Item 12R is contract J. Banicki Construction, Inc., Jomax Parkway, Vistancia Boulevard to Loop 303 improvements. And I will ask our city manager, Mr. Tyne, to begin.
Thank you, Mayor and Council. There's considerable interest in the planned construction projects to provide additional access along Loop 303 in northern Peoria. To that end, Adina Lund, our Development and Engineering Director, will present a contract for your approval to construct at Jomax Parkway, Estancia Boulevard to Loop 303. And with that, I'll pass it over to our engineering director.
Good evening. I'm very happy to be here to talk about this project. It's been a long time in the making, as so many of our projects. I wanted to start with a little bit of the background on the project. As you are probably aware, right now, Loop 303 is undergoing a widening project by ADOT between Happy Valley and Lake Pleasant Parkway. They're also building a new traffic interchange at Jomax, which is where this project comes into play. Both of these projects are part of the MAG Regional Transportation Plan, also known as our Prop 400 or our half-cent sales tax. So both of these were funded many years ago. They're also part of our city transportation plan that is embedded within the general plan that our voters just approved in November. This new interchange will help to serve the Estancia Commercial Core area, that 300 acres that we're hoping to activate. That is also served by the Lone Mountain Interchange. It may possibly activate some state land parcels along Loop 303 as well, causing them to go into auction, which would be wonderful for us. As you know, there's much residential growth in the area, and I've listed some of the subdivisions that are under construction. Surprise, in the county also have many subdivisions along Happy Valley Road, far to the west, that are under construction. This has caused a lot of congestion at Happy Valley and Estancia Boulevard and at the Happy Valley interchange with the Loop 303. So we conducted a design concept report, which is a fancy name for a study, and we included all of our partners, and we looked at the entire area for Jomax within our city, and we broke it into the 4 segments as shown on the graphic. The blue segment is what we're talking about tonight. The green segment, which reaches from Estancia to El Mirage Road, we are showing that that would be needed in year 2030. It could be advanced in the future if El Mirage Road connects to the 303 before then. Then we're showing a section on the east side of the Loop 303. The tiny little orange section, that goes from the interchange across the Beardsley Canal. And that section we showed, if there's any interest in the future of that sand and gravel operation, having trucks be able to get to that interchange. So just to build that section across the canal is $7 million, and then there would still need to be a road for that sand and gravel operation. And that would be coordinated through state land and other property owners in the area. The yellow or goldenrod is that connection from Beardsley to Tierra del Rio, and it crosses a major wash and the Agua Fria River. So the price tag on that is a whopping $70 million. We are projecting that would be needed after 2040. So long after many of us will be sitting here. But I just wanted to show you that we have taken this into consideration, and because it's regionally funded, we did bring in all of the partners to look at this together. So let's get back to where we're supposed to be talking about tonight, and that's what we're building. So as you can see, the Loop 303 interchange was always planned to be there, and ADOT is out there building the last remaining segments. Our section will provide 2 lanes in each direction, connecting to Estancia Boulevard with a new signal. It will include median modifications for turn lanes needed on Estancia. There will be a landscape median on Jomax, and that will be filled with desert vegetation, and I mean desert vegetation. It will be cacti and desert trees because there is no water in the area. So we'll be doing a temporary irrigation system for 6 months to establish the plants. It's all very interesting. We've been working with Parks on it. We have included some pictures of the construction that's been going on the 303. So just if you haven't been out there, it's always fascinating to watch construction, at least from my point of view. For this project, we went through the procurement process, which materials management and finance handles for us. We had 6 contractors bid on the project, and the bids range from our low bid tonight, which is approximately $3.6 million, to $4.2 million. The 3 lowest bids were all under $3.8 million, which is always good for us to see that there wasn't a great discrepancy between those lower bids. Jay Bannicky is the low bidder, and they have done past work in Peoria. They have been awarded job on-call contracts with us before for our bridge program and roadway projects. So they're very familiar with our process and procedures, and we've worked well together. One thing we always like to talk about is traffic. What's going to happen during construction? The pictures that you see of ADOT's project, they were able to erect temporary concrete barrier and maintain traffic flow through the area on the 303. Shoulders are taken away in much of the area, but the travel lanes remain. For our project, we will only be out in the middle of traffic when we're connecting into Vistancia, doing that signal and median work. The plan right now is to have nighttime closures between 8 and 5 a.m. with one lane open in each direction. If we did have a closure, we would minimize it for the specific work that had to be done. So as we sit down with the contractor, we will detail when those timeframes are. We also have a public improvement and a public involvement plan so we can notify the people in the area that use the road. On to the bigger project schedule. As you can see, ADOT's big orange project, stretching all the way from Happy Valley to Lake Pleasant. They started in December. Our project, the little tiny section next to the star, will be starting in March or April of this year. The construction is coordinated between both companies and the project managers attending each other's construction meetings. And both projects are scheduled to be open in the end of January of 2022, so a year from now. And ideally, COVID will be much in control and we can have a lovely ribbon cutting and celebrate this new connection to the north from the 303. Staff is recommending that we award the contract to J. Banachke Construction in the amount of $3.5 million and some change to construct Jomex Parkway from Vistancia to the Loop 303 interchange. Do you have any questions for me?
Thank you. Council, are there any questions for Ms. Lund? No questions, because it was such a great presentation. So do we have a motion on item 12R?
I motion to approve item 12R.
We have a motion and a second. Council, please vote. And it passes unanimously.
Thank you.
Thank you. All right, our next item is 13R, Industrial Development Authority Joint Bond Issuance, Peoria Regional Hospital. Mr. Tyne?
Great, thank you very much. And Rick Buss, our Economic Development Director, will present on this item. Really an exciting development and financing opportunity, as you'll learn about, and something we haven't seen as much recently in Peoria. So with that, I'll pass it to Mr. Buss.
Well, good evening, Mayor and Council. I think we have some happy news to discuss this evening. We're talking a little bit about Peoria's first hospital and how that's come to pass. So one of the things that, just to reiterate with council, is when we look to attract prospects, we look at 4 different areas. It's part of our business strategy and approach, attraction strategy and approach. We look for prospects that can fund, design, construct, and operate. And so it's if you don't have the money, these are just pretty pictures, right? But we also look at for the long-term sustainability and viability for prospects to flourish in the city of Peoria. So this project is no different in what how we've approached to bring this group in. So I thought it'd be helpful. A lot of folks ask us, well, what is an IDA? So IDA stands for Industrial Development Authority. It is an independent political subdivision of the state of Arizona. It is not part of the city. It is independent. However, the city does have a role in it. It does a variety of things: bond financing, community developments, does home ownership, does sponsorships of local community, projects and programs. But in this, they serve primarily from a bond issuance capacity is a conduit issuer of private activity bonds, which attract private investment to finance projects to provide a public benefit. That's a mouthful that says basically these bonds are all privately issued. These are not public bonds. They pass through the IDA to get a public benefit, and in this case, a hospital. It is an economic development tool for us. It is one of those things that we've talked about in the past. It's a non-financial incentive. The work that myself and my staff has done to put all the details together on this, it is an incentive to that developer to bring this opportunity for financing. It's part of our capital market strategy. So we again talk about how important it is to bring funds to projects. And it's also part of our target industry, medical and biomedical. And Mayor and Council, we still see about 20 to 25% of our deal flow being in the medical and biomedical target industry. So the City Council serves about 3 different roles in this, to summarize. You approve the formation. I'm pretty sure nobody was on council in 1977, but that's when the Peoria IDA was formed. You appoint and remove board members. Tonight, we had Michael Mitchum that was appointed to the IDA board. And then you approve resolutions for bond issuance. So I go back for a second. And that's basically one way one of the bond attorneys explained to me, says, from a council's perspective, you're really voting on, is this good for the city? Is this a good project? Is it beneficial for the city? Because you're not issuing any bonds as a city. So a little bit about the project. I think the council is very well aware of this, but for the benefit of folks watching at home, it is just north of Yearling, south of Jomax, to the west of Lake Pleasant Parkway. And you see the two basis schools are there. And then the neighborhood to the east is Carencia. And there's a reason why I put Carencia on here. So a little bit of site history review. In 2010, the original developer had commenced construction. 2011, it stopped. And that's because of bankruptcy ensued. Again, gets back to that common theme of funding. The structure was abandoned for a little over 9 years, which I know the mayor and council is very much aware of that. So over the last 2 years, we worked to market, recruit, assist, and sit with multiple meetings to bring this team together to make this a reality. And publicly, I'd like to thank Kirsten Hall in my department. She has worked her tail off on this project and is very well liked by the group as well, but she has been just fantastic in the effort to bring this to fruition. So in 2020, a new group purchased land out of bankruptcy court, and part of that agreement with bankruptcy court is they had to demolish the structure. A question I get a lot from business folks, citizens, and even the media is, well, what did that cost the city? It cost the city exactly $0. So that was all done by the new ownership. And then we identified a development finance team and started plans. So 2020 did have some benefits. A lot of work was done that. I think, Mayor, we talked about this. I think the lower right-hand corner was your favorite picture.
That's right.
Right? So there's an initial rendering of what the first phase of the hospital will look like, and this all deals with the first phase. It is a full-service general acute care hospital, 32 beds. I won't go through all this, but it is in conformance with the current PAD, which the vision of the city was to build this largely as a medical-based entitlement. It will bring about 150 full-time employees, and the investment into the community, these are all net new investments, net new employees, about $130 million. So what's the schedule for financing and construction? We get this question a lot. So closing of financing, they're looking to do that in March, beginning some construction activity in April 2021. So it was probably difficult to see in that picture, but the foundation is still there, so they're going to take out that foundation, move it. They've got some utility movements, some grading to do, but they're looking at trying to begin that in April 22 and then open in July of 22. It is a very aggressive schedule, and we hope that they can meet that. So Carencia, if you see the circle there, part of this requirement of this development is they will have to put in a traffic light. And so I know Mayor, Councilmember Binsbacher, your constituency, has long wanted to make a left-hand turn and not have to take a right up to Joe Max, make a U-turn, and come back down Lake Pleasant Parkway. Details to follow, but this will come to reality. It not only benefits Carencia, but also some of the traffic issues we have with Basis School. So it's a nice benefit. It's a partnership between the hospital, who will have to do this anyhow, along with the public benefit. So more details come, but I want to point that out. It's a nice tangential benefit. So I'll go through this very, very quickly, and largely just to demonstrate how many folks are involved in this. So ownership is Sunline Medical Foundation. They're a nonprofit. They are wholly owned by Peoria Regional Hospital, which is an LLC formed for this, and First Service Medical owns the land. The developers, Medica Development, they're out of Texas. They have been doing this for about 40-plus years, specifically in healthcare facilities. And the operator is Quorum Health. They are publicly traded and operate about 150 hospitals in 39 states. So the architectural engineering construction team All the professions, architects, engineers you see up there have already been identified. They are in the final phases of bidding out the general contractor. But, I also want to publicly recognize our team, in particular Planning, Development Services, and Engineering, because they have been working in the background. Why we've been forming all this funding and financing and dealing with a lot of attorneys and finance professionals, they've been working behind the scenes to, let's get this ready. Things like the traffic light. You're going to need a traffic light. How do we work this out? Is the planning solid? Can you move the site over a little bit so we can realign the road? And I will tell you, Medica Development raves almost on a weekly basis on how good it has been to work with our Planning and Development Services and Engineering team. So, thank you to both Chris Hawkes and Adina Lund's team. They've been great. And that's an important part of this. So, a lot of eyes on this. I entitled this as due diligence. So we brought in a partner with the Peoria IDA. So this is a joint issuance with the Phoenix IDA. And why did we do this? We needed the experience, the expertise, the support, and it also adds credibility because Phoenix IDA has done a lot of these projects. And it's not unusual for them to partner with another community. They've done it with Tempe, they've done it with Scottsdale. And because our IDA does not have a staff, and we just became, I guess, fully staffed at the board level this last meeting, we could use the help. And also put another set of eyes on this, and we thought that was important. A lot of legal counsel on there. There's general counsel, there's Israel co-bond counsel. There's, I think, 5 different law firms involved in this that have done this a lot and have got the experience in this. And under the finance heading there, Dixon Hughes Goodman, I want to point this out because one of the bond attorneys told me this is probably your most important document for the IDAs. It is a third-party feasibility analysis. It is extensive, and they look at it, is this actually going to work? And it came back extremely favorable. One example, so the debt coverage ratio, you're usually looking about 1.25 to 1.3. They're 1.77, 1.8, so it's come back to be very, very favorable. Again, the big message here is there's a lot of vetting and due diligence that has went on this, a lot of eyes. So Mayor and Council, you probably get questions like, and we've got this from some folks that have called us as well as the media is, well, what does this do to my taxes? It does absolutely nothing. This is not a public bond. It is not a municipal bond. It has nothing to do with that. They are private activity bonds, which means they're bought and sold on the private market. Investors come in, they buy the bonds. Those proceeds go to fund the hospital, and then those hospital revenues go back to pay off the bonds. I've got institutional market on there because these are going to be targeted towards accredited investors in institutional market, which are, in SEC language, considered sophisticated investors. Again, conduit issuer, these are non-recourse bonds, and there's no liability to both either the city or the IDA. The liability all rests with the underwriter and the ownership. So the finance schedule, just very quickly, the legal review and feasibility study have been completed. The Phoenix IDA had unanimous approval on the 14th. We held a TEFRA hearing here in the fine city of Peoria on the 21st. And then our IDA passed it unanimously on the 21st as well. The highlighted section is where we are today for the Peoria City Council to approve this resolution. So again, I'd like to reiterate, this is not bonds. This has zero to do with taxes or anything. Your citizens will not see any of this. And finally, questions and comments and, recommendation, is clearly to approve this and so we can bring the city to the first hospital. Mayor,
Right.
Council.
Thank you. Councilmember Binsbacher?
Thank you, Mayor. Well, I want to say thank you and congratulations to everyone involved. I know there's so many individuals and departments involved in this, and it's been a long time coming. And it took a tremendous effort and collaboration to get to this point, and this is huge. And yes, our favorite picture is absolutely, down to dirt. The left-hand turn is a big bonus, though, also a topic of conversation and very important to that community. I want to reiterate a couple of things that you've said multiple times. These are not public bonds, these are private bonds. They will have absolutely no impact on the taxpayer.
Correct.
The question of what did the demolition cost the city has come up. And I just, again, want to reiterate, it costs the city absolutely nothing. A couple of years ago, I don't know the exact date, this mayor and council, we voted and approved funds for demolition, we've been able to do that. Had we gone that route, we would have leaned the property to get those dollars back. So we were never planning on footing the bill for that demolition, but trying to find a way to get to that point in those circumstances. Today, different circumstances, much better, but still cost us nothing. Can you tell us how many jobs this new facility will create? Do you have that off?
Mayor and Councilmember Binsbacher, direct jobs 150. And, I don't have the calculations for derivative jobs off of that, but it'll be 150.
Significant.
Within this development. And to your point, as far as not paying any money, recognize, talk about how many departments involved in this. This came out of bankruptcy court, and, Vanessa and the city attorney's office helped negotiate that they're going to pay this, and they have to, move, in certain speed and, all that kind of stuff. So, they're a part of this from the beginning, and so, thank you to Vanessa and her team as
Definitely.
well. But yeah.
Well, thank you.
Yeah, absolutely.
Great work.
Councilmember Dunn?
Thank you for the great presentation. I'm very excited to get another hospital in Peoria, and that it's not going to cost taxpayer money, and that's including the left-hand turn light and everything.
Correct.
That's fantastic. Thank you to everybody. Thanks, Vanessa.
This will have no effect on taxes at all. So, yeah.
I'm very excited to see this happening. And, the previous Peoria Regional Medical Center that tried to develop in this space was a completely private entity. The city did not have the ability to go in and do any kind of analysis on their financial capabilities or their partnerships, between all of the doctors and their corporate structure. And so we just had to wait until they made their way through bankruptcy court and we were able to finally, move forward with something on that property. So now in this case, there has been a feasibility analysis done that gives me a lot more comfort than what we've had in the past, and I thoroughly appreciate that. I have one question. Is this company also interested in the remainder of that property there that was originally owned by PRMC?
Yes, Mayor, members of council, yes, they are. They have been in discussions with the 5 acres to the north and the 27 to the south. And so that's probably what I can say at this point. But yes, and I'd also like to point out that this is not an unusual way to finance hospitals. Banner, some of the bigger names, Banner, Dignity, Honor Health, they do finance through IDA for various projects. Mayo Clinic finances through IDAs as well. So. But yes, they are in discussions on the 5 and the 27 as well. So we're you can't see behind my screen, but my fingers continue to be crossed. So,
I believe it.
Right.
I believe it. All right. Well, thanks very much. Council, seeing no further discussion, do I have a motion?
Second.
And we have a motion and a second. Council, please vote. Passes unanimously.
thank you, Mayor, Council. Thank you.
Thanks for all your work on
Thank
this. Move on to item number 14R, specific area plan amendment, Triana Park, Thunderbird Road and 88th Avenue. And item 15R is also planned area development, Triana Park, Thunderbird Road and 88th Avenue. So we can hear both of these at the same time and then vote on them separately. Mr. Tyne?
Great, thank you. And I would be remiss if I didn't mention on the last item that there was one key person that was not identified in all of the stakeholders, and that was Rick had done such an amazing job to coordinate with all of those different entities, and I'm personally handheld, recognizing that that instrument was such a critical tool to make this occur. So kudos to Rick for handling what is well beyond a traditional economic development director, but putting on his CFO hat, his legal hat, and all those different pieces, and working especially the relationships he had to make that happen with Phoenix IDA as well. So wanted to mention that, if I may.
Thank you.
Now, moving to this item, as Mayor had mentioned, we'll have one presentation for the next two items, and we have our Planning and Community Development Director, Chris Hawkes, to present this.
Great. Thank you, Mr. Tyne, and good evening, Mayor and Council. Absolutely, definitely some exciting projects tonight. 14R and 15R, the applicant for these projects is Evan Bilton with Next Gen Apartments. Next Gen is based in Scottsdale, but they are they build and manage projects throughout the Southwest region. They are represented tonight by Jason Morris from the law firm of Withy Morris. The site in question is indicated in red on the screen. It is a flat, vacant site of approximately 12 acres, and it's located at the terminus of 88th Avenue. So it is wedged between Loop 101 to the east and the New River Corridor to the west. 14R is a proposal to amend the Triana Park specific area plan. I'll talk a little bit about that in a second. And the second piece, 15R, is a request to amend the Triana Park PAD zoning. If approved this evening, this would facilitate a 234-unit gated multifamily residential community. As indicated, there are two actions tonight. The first action pertains to the Triana Park specific area plan. So what is a specific area plan? That's a more detailed and focused implementation tool of the general plan. We've got several throughout the city. This specific area plan was adopted in 2006 and had designated the subject site as high-density senior living or attached single-family residential. So the applicant is requesting to amend the specific area plan to multifamily residential for the site in red that we refer to as Parcel 6. The second request pertains to the PAD amendment, or PAD zoning for the site. The PAD is a type of zoning district where the uses and development standards are customized for the area. The zoning determines specifically, how property can be used in certain areas. So the request tonight is to amend the PAD uses for Parcel 6 from behavioral health facility, dementia facility, senior living, and medical offices to a parcel that is for multifamily residential. Okay, the Triana Park specific area plan or development consists of 48 acres. It is most of the area south of Thunderbird between Loop 101 and the New River. It is somewhat of an isolated peninsula. It is accessed from either the signal at Rio Vista Boulevard, and that is the signal where there is a Biscuits Cafe, the former QT was there, or 88th Avenue. 88th Avenue is to the east of that signal, nearest to the Loop 101 Avenue. Outside of the Biscuits Cafe, the area has been developed with multifamily residential with vacant lands. There are vacant lands along the Loop 101 strip. And that area has about 3,000 feet of Loop 101 frontage. The multifamily areas, I would say they're well situated to provide workforce housing, not only for the Plaza del Rio, which has predominantly a medical and office complexion, as well as the Empire Business Park areas to the south and east of Loop 101 area. The Triana Park area is also physically separate from single-family residential areas that are west of the New River, the reserve at Plaza del Rio, via the New River Corridor. So the area in red, as I indicated, that's specified as Parcel 6 in the PAD. To the north of this is an existing apartment complex called the Visions Apartments, that they also consist of 3-story apartments. To the east is the Loop 101 and vacant commercially designated land along the Loop 101 freeway. To the south is vacant land owned by the Flood Control District and the New River. And then, of course, west of the New River is the Plaza del Rio, which is a mix of office, medical, there's some multifamily uses, and single-family residential as well. This graphic illustrates the Triana Park specific area plan that was approved in 2006. This plan was originally conceived by the Gray Development Group. It includes the whole island except for what was already in place at the time, and that's the the Biscuits, formerly the QT site, and also that multifamily development west of the QT. So that's not part of the specific area plan. This specific area plan was envisioned with a mix of uses with residential, office, hotel, and commercial uses. So looking at the specific area plan, the areas in orange that you see on the screen, parcels 1 and 3, they were developed as multifamily, 3-story multifamily, I think around the 2006, 2007 era timeframe. The area in pink along Thunderbird, that's designated for retail and commercial development. Just to the south of that in brown, parcel 4, that was envisioned as a hotel site. And then the, what is that, gray? Yeah, the gray strip south of the brown strip, that's all designated for garden office development. And then the parcel that we're talking about tonight, parcel 6 in red, that was planned for either, and it had 2 development options, but it was planned for either high-density senior housing or attached single-family residential. Now, since the 15 years that this specific area plan has been in place, as I indicated, only the multifamily portion has developed. The areas along Loop 101, they remain vacant, but designated for commercial and office development. Again, I would say that those areas, they enjoy good visibility. Perhaps they've struggled to develop because of the limited access. It's rather limited and circuitous, so that might have hampered the development of those commercial areas along the freeway frontage. The specific area plan, again, was approved in 2006 and was, for parcel 6 rather, we'll focus on that area, designated for high-density senior housing, and it could have accommodated up to 860 senior housing units, which is 67 dwellings per acre, or it could have been developed for attached single-family residential with a maximum of 10 units per acre. So pretty wide disparity of residential uses, but it had a residential disposition with the specific area plan. In talking about the PAD zoning, which was also put in place at the same time that the specific area plan was developed, the uses that were approved for the PAD aligned with the specific area plan. So it allowed the high-density senior housing or the single-family residential. The senior housing could be up to 48 feet was the maximum height. If it was residential, it would be a 30-foot maximum height for the single family. I will note that in 2018, there was a major amendment to the PAD that added behavioral health and dementia facilities. We had a group at the time, Springdale Center, that had planned to develop there. That plan didn't come to fruition, and so now we have the current proposal in front of us for multifamily residential. So let's take a look at that development plan. Now, this is just a concept development plan. So again, if the entitlement is approved tonight, the next phase of the process will be to go through site plan and design review. And at that point, we'll get more involved with the details of the site plan, including the architecture and access points. But a little bit about the concept here. This is a 234-unit multifamily community. It's a gated community, so that computes to a density of about 21 units per acre. It is predominantly 3-story buildings, and those are the bigger footprints that you can see on the screen, and then some smaller carriage buildings. The units are roughly split between 1-bedroom and 2-bedroom units on the site. There is about a 10-foot separation between the buildings on the western side from the trail along the New River. And in that area, there will be a landscape buffer, and they will be planting 36-inch box trees, which are the larger trees we normally see 24-inch when a project begins. Also, other things they've talked about is exterior lighting would be limited to 16 feet. They'd be shielded and directed downward, and that was in response to some questions we had for some citizens during the process. So there'll be low-level residential scale lighting, and units also have private balconies. With regard to the site elements, let's zoom in a little bit on the site plan. There are 2 amenity areas. The first amenity area is in the middle of the site, and there's a 2-story clubhouse, gym, pool spa, and some cabanas, along with a turfed area with some outdoor barbecue areas. The second amenity area is in the northern portion of the site. It's a smaller lounge pool and also a barbecue area. There are 2 points of access into this development. I've indicated them on the screen. The primary access point will be at the terminus of that cul-de-sac. That will get you to the leasing office and the clubhouse, and then the secondary access point along the northern edge of the site for exiting. Looking back, this shows access from a regional perspective. As part of the rezone, a traffic statement was prepared by a registered engineer, and that traffic statement was reviewed by the city's traffic division. The 234-unit development, this generates considerably less traffic than the 860 units that were originally entitled as part of this PAD. So the main access to Triana Park that exists today is the signalized access at Thunderbird Road and Rio Vista Boulevard, which provides full access. And then the secondary access point is 88th Avenue. Currently that, if you're exiting this area from 88th, it's right in, right out only access. If you're going westbound on Thunderbird, it's currently left in, they have a left-in turn pocket. As part of this development, it's likely that the left-in turn pocket will have to be enlarged, but we'll take a greater look at that during the site plan process. This graphic illustrates the conceptual design theme and the massing of the project. Again, as I indicated earlier, we'll get into a more detailed review of all the building and architectural components during the site plan process. But here that you can see the internalization of the amenity areas in the middle of the project. The architecture is intended to be more contemporary, but also to be complementary with the apartment complex that's directly to the north of the area in terms of style. With any entitlement project, there is a public outreach process. As part of that, there were 2 neighborhood meetings. The first neighborhood meeting, of course, in this COVID period, it was conducted remotely via Zoom. That was held on September 21st. We had 1 attendee from the Plaza del Rio subdivision to the west of the New River. Inquiries were on what the expected rents would be, pedestrian traffic that this would generate, and there were concerns about noise from the Loop 101. And then we had a second neighborhood meeting in December, also via Zoom. We had 3 attendees to that meeting. 2 were community association managers and 1 was a resident, and they were from communities east of the Loop 101. And the inquiries that they had was on the scope of the project, what would be the proposed land uses, and what would be the traffic generation from this development. Also, with any rezone application, we provide a notice of application at the front end of the project, invites citizens and the public to come out and get more information on the project. We also provide a notice of neighborhood meeting, and prior to going to hearing to Planning Commission and Council, a notice of hearing postcards. We send those to all property owners within a 600-foot radius and all registered HOAs within a mile radius. The site is also posted, and we publish all our advertisements in the Peoria Times. So through the course of the project, in terms of opposition and support, we have received 11 emails in opposition. Now, these emails came prior to the first neighborhood meeting back in September. All of the emails were from the Reserve at Plaza del Rio community. That's the single-family community west of the New River. We received those. They had concerns about the visual impact of the building heights. And as I indicated, the building heights could be 48 feet under the current entitlement. The buildings here will be 3 stories, not the 4 stories, and 36 feet. Also, as indicated, there'll be a landscape buffer that will help shield the buildings or provide some of that visual buffer from points west. And also, you might have noticed on one of the prior slides, there is about 480 feet of separation between this development and the single-family community to the west. There were also concerns about light and noise pollution from the surrounding areas. Again, as I indicated with the lights, those are going to be limited to 16 feet, so kind of a residential scale. They're not going to be on the upper levels of the 3-story building. Also, in terms of noise pollution, you'll recall the amenity areas are internalized within the site, and also, arguably, the buildings will provide some additional attenuation from the ambient noise that you'll get off from the Loop 101 traffic area, so that should help as well. And then with respect to vehicle traffic, there is no direct impact from vehicle traffic to those neighborhoods to the west across the river corridor. We indicated earlier too that this development will generate considerably less traffic than the current entitlement for the 860 units as well. And as we indicated, the Thunderbird access points are sufficient, deemed sufficient to handle this development type. We also received 7 emails in support. Those emails were received prior to the Planning and Zoning Commission meeting. And we also received correspondence from the Peoria Unified School District in support. They have worked through a voluntary developer assistance agreement with the applicant. And so that agreement will be executed upon the positive action on the zoning case. The case went to the Planning and Zoning Commission on January 7th. We didn't have any speakers that evening, and after deliberation, the Planning and Zoning Commission voted unanimously to recommend approval to the City Council. So in summary, what are the key findings here tonight? This project retains the original residential disposition for parcel 6. It does have a density of 22 units per acre, but that is considerably less than the 67 that would be permitted with the senior housing. It does provide for workforce housing, again, in close proximity to Plaza del Rio and the Empire Business Park, and we believe the amendment is an overall improvement with the lower height of the buildings, along with the buffering and the internalization of open space. We believe overall this is an improvement to the PAD. And then finally, as we require, we did get a sign notarized Proposition 207 waiver from the applicant. So, Mayor and Council, again, there are 2 actions tonight. 14R is the resolution for the specific area plan amendment. Item 15R is the PAD amendment for the change in zoning there. So I'm happy to take any questions. Also, we have the applicant, Mr. Jason Morris, available as well. So,
Thank you. Council, are there any questions for Mr. Hawkes? Vice Mayor?
Thank you, Mayor. Chris, can you go back to the slide that had the map? That one, yeah, there you go.
That one right there?
Either one of those is
Okay.
fine. So with that property development right there along the New River Trail, was there any talk about access to the New River Trail? Because I see that there's no access to the trail system.
Mayor, Vice Mayor, members of council, yes, absolutely, and access to the trail will be provided as part of the site plan process. So that was part of that discussion.
So they'll have some kind of a security gate of some sort for residents to go and access the trail?
That is correct, that's
Okay.
right.
That's all I had, thank you.
Thank you. Any other comments? All right, seeing none, do we have a motion on item 14R, which is the specific area plan amendment, Triana Park, Thunderbird Road, and 88th Avenue?
Move to accept 14R.
Second? And a second. Council, please vote. And 14R passes unanimously. And now we will vote on 15R, planned area development, Triana Park, Thunderbird Road, and 88th Avenue. Do I have a motion?
I also move to accept item 15R.
We have a motion and a second. Please vote. And that passes unanimously. Thank you very much. All right. The next item on the agenda is call to the public on non-agenda items. If you wish to address the City Council, please complete a speaker request form and place it in the bin next to the speaker's podium. And we have not received any speaker request forms. So we will now move on to reports from the city manager. Mr. Tyne.
Thank you, Mayor. And wanted to have Jennifer Stein, our communications director, to present an update on consumer research that the council recently approved, as well as a progress on the subsequent Shop Local campaign, helping our Peoria businesses as they reemerge from the effects of the pandemic. So with that, I'll pass it to Ms. Stein.
Thank you, Mr. Tyne. Good evening, Mayor and Council. Before I delve into the exciting Shop Local campaign and the outcomes and takeaways, I just want to take a moment to kind of recap the business initiatives we've been all working on since the pandemic began. We were on a mission, we were all on a very critical mission on an accelerated timeline. So I want to acknowledge you, Mayor and Council, and thank you for all your support and direction and guidance as we tried to navigate through this quickly and get support, especially this is geared toward our business community right away, and give them something meaningful while encouraging our residents to support them locally. So with that said, I will jump into kind of an overview of, I don't even know if there's enough room on our slide of all the things we've done, again, collectively together, business grants, and again, it's a multifaceted approach, working with multiple departments throughout the city, but we've seen such great success on our business grants, the signage support. If you remember, immediately when the restaurants closed due to the executive order, we worked on getting them open for deliveries or takeout signage. We did a number of communication and check-ins, many, many phone calls, thousands of phone calls. Outdoor patio ordinance extension, giving restaurants the opportunity to expand their footprint outside. We have and still do have a special webpage dedicated to all the different resources. And then we did numerous videos and live Facebook Q&As to help educate the business community on what those resources are and how they could take advantage of the grants. So I just wanted to make sure to point that out before I move into the Shop Local campaign. And then at the end, the most exciting part is the video we did. Nick Serpa, our digital media specialist, put together an amazing open for business Shop Local video that I really wanted to make sure you have time to check out. And if you haven't already, this is a good one. Or you might see it again because it's been actively all over. Okay, so when we started, before we started actually, and the mayor had a business task force that really prompted this, because the feedback we continuously heard was the marketing support was imperative to make sure people knew, hey, we're open for business, we have protocols in place, we want to, accommodate, and so, accommodate their customers. How could we meet their needs in reaching out their audiences, which is basically our, we all have a shared vision of making sure everybody realize how they can support and, shop local. Really, essentially, that's the theme that we've been working with. So before, we had a number of surveys go out to kind of gauge people's feelings, habits, thoughts on what are they doing? Are they shopping? Are they comfortable? Are they doing takeout? And that would help us determine what's the best message when we started targeting this advertising campaign. 95% of residents typically do shop in the city of Peoria, in the area. We also found out 77% of the residents typically dine in the Peoria area, and 85% of residents believe that local businesses are following COVID-19 protocols. So these are good stats. This is what kind of helped us develop, who are we going to, again, target our messaging. And we had 4 different personas, as you can see. These are made-up people, but they represent the survey responses we received. And you can see experience-driven Emma. She was one of our target markets. COVID-cautious Carol, price-conscious Pedro, and COVID-fatigued Frank. So they had specific messaging geared toward each group. And then we identified, again, the pieces or the elements that these personas represented. So they're looking for a unique vibe, or a family-centric, or quality service. So those are just to give you kind of an idea of how we started to shape the campaign. So if you've seen around town, we've had these ads in various newspapers, bus shelters, social media ads. Again, what was nice is we have a brand in existence, which is Peoria's the Place. So we wanted to tie in, find your place with Shop Peoria, go big, shop small. And so this was really the fun part, because we were able to, with an ad agency, target our local news media. So we have a couple of examples, and then also do strategic, thoughtful placement through emails, social media, and various influencers. So it worked out really well in terms of how we approached the outreach. Campaign results. This is actually the most exciting part. Before I get to the video, which I told you is really sums up the campaign, but we launched this Black Friday. And after that, we saw a number of web users continue to grow and visit the site. We saw a 56% increase from the first month to the second month. We also saw 224,000 social media users were reached. So we can tell now we're starting to track the results of the campaign through the QR code, which was placed strategically on the different ads and emails and web, including we even added a QR to one of our videos. We could tell who's downloading, who's clicking, who's tracking, and we can attribute 27,369 business visits to people who saw our digital advertisements. That direct correlation is coming to our businesses. And then we also saw in December to January, a 1% increase in consumer spending, which again, in the holidays, you start to see the opposite occur, but in this case, we were able to track the campaign's results. So pretty exciting data there. And then with that, I'm going to go ahead and we'll launch in the video.
Peoria was born in the heart of the Arizona desert. To thrive here requires resilience, grit, innovation, and above all, community. That's something we've understood from the very beginning. We are a city of dreamers and doers, entrepreneurs, restaurateurs, artists, educators, neighbors. We thrive on challenge. We persevere because we lift each other up. Sure, the pandemic threw its punches and we took a few hits. But instead of throwing in the towel, our community dug its heels into the sand. We've opened new businesses and found new ways to keep business going. We supported one another and committed to keeping each other safe. We embraced new technology and brought back old school service. We masked up, we hunkered down, and we never, ever gave in. And now, we're bouncing back, stronger than ever. So whether you're a longtime resident, a small business owner, or discovering our extraordinary community for the first time, thank you for being the heart and soul of our city. Let's keep building. Let's keep adapting. Let's keep innovating. Let's keep supporting the people and businesses who bring energy and opportunity to our neighborhoods. Do your part. Shop local, dine local, support local as much as you can. And let's spread the word that Peoria is, and always has been, open for business.
Thank you. Do you have any questions?
Gosh, how fun is that? I love that video. Go big, shop small. I especially love we are a city of dreamers and doers. I love that. Council, did you have any comments?
Just amazing. Really good. Thank you.
Did you hear those? Just amazing. Love it. It's fun. Yeah, and your stats are tremendous, really something to be proud of. It's great that we were able to do everything that we could for our small businesses in such a very unique, strange, unprecedented time. I wish it was over. It's not quite over yet. But thanks for everything that you did. Appreciate it. All right. Anything else, Mr. Tyne?
I'm going to end my report on that. It's all about momentum.
All right, we will now move on to reports from our youth council liaisons, and we will start with Mr. Van Winkle.
Thank you, Mayor and Council, residents of Peoria. The Youth Advisory Board is now accepting new applications for membership. You can check out our Instagram for a link to an informational page about the Youth Advisory Board. Our Instagram handle is @PeoriaAZTeens. The link will also be on our Twitter account by the same name. We accept members of grades 7 through 11 that are Peoria residents. And the city website also has Youth Advisory Board applications. You can just search up Youth Advisory Board on the city website, and you should find everything you need. And we're excited to recruit new members and to be able to continue to diversify our board and make those positions more prestigious. So thank you.
Thank you. And Ms. Torrey.
Thank you, Mayor and Council. So as mentioned before, February is Teen Dating Violence Awareness Month, and Bloom 365 is one of the nonprofits that the Youth Advisory Board collaborates with. And Bloom 365 has a campaign called #GoOrange, and what that means, yes, and what that means is that Bloom 365 is trying to get at least 10% of residents in Peoria or in any school community to wear orange and use the #GoOrange on social media to raise awareness and to remember the victims of teen dating violence and domestic violence during this month. So that's all I have to say.
Thank you. And thank you for reiterating that. It is so important that we go orange and that we support that organization, Bloom 365. And with that, there being no further business, we are adjourned.